Hello. Today I would like to talk to you about the role of diet in treating arthritis. Arthritis actually is a group of conditions that cause joint pain, joint stiffness, joint tenderness, and all those inflammation that causes pain. There are two common types of arthritis. One is called osteoarthritis, which is basically a tear and wear of the cartilage, which basically protects the end of the joints. And that's very common in older age. But the rheumatoid arthritis actually is the type of arthritis that's considered as an autoimmune disease, and basically it's inflammation of the synovial fluid, which basically lubricates the joints and causes a lot of inflammation, a lot of pain, and it can be genetic, it can be environmental. There are many reasons for having rheumatoid arthritis, and usually when we have rheumatoid arthritis, it's usually in the younger age. Both of these type of arthritis, they have similar symptoms, and diet can play an important role to help with the relief of pain. Overweight or obesity are some of the risk factors that when they are addressed and people lose weight, they do better with the pain and movement. Other treatments that we have for arthritis are basically medications, some painkillers like ibuprofen, Advil, Aleve, aspirin, or some ointments, are very helpful to relieve the pain. For rheumatoid arthritis, there are different kinds of medications that help with, the immune system, supports the immune system, at the same time helps, the inactivity of the autoimmune, problem that the immune system kind of like, attacks the joints. So basically, it just reduces that process, and they're very, very significant in reducing the pain. Exercise, hydration, weight loss, all of these factors are important to improve the symptoms and have less pain and less swelling, less inflammation in the joints. However, when it comes to diet, what we recommend is basically a healthful nutrition, a diet that is high in fiber, especially fruits and vegetables, colorful fruits and vegetables, and whole grains, and basically foods that are anti-inflammatory and would offer you omega-3 fatty acids, which I will discuss them a little bit more in detail. But what you like to avoid are all types of foods that can be inflammatory, like salt, sugar, saturated fat in animal proteins that are high in saturated fat. You can have the ones that are low fat, but also fried foods, processed meats, refined carbohydrates, like all those white flour, white pasta, white bread, going to whole grains is very important. So basically, more fiber in diet, more color in the form of like colorful vegetables and fruits. The more color, that means more carotenoids, precursors of vitamin A that have a lot of antioxidant kind of properties. They're full of antioxidants. Anything with that is high in vitamin C, like citrus fruit, berries that are high in antioxidants, like blueberries, strawberries, blackberries, raspberries. These are good fruits. Also, these fruits are low in sugar. At the same time, nuts that are high in omega-3 fatty acids, like walnuts, or seeds like pumpkin seeds. These are very important in terms of like offering us healthy fat, and also helping us with inflammation. Certain foods that offer us probiotics, like kefir or yogurt. These are also good, very anti-inflammatory. At the same time, beans are high in fiber, very good substitutes for protein, and in addition to all of that, hydration. The more we are hydrated and not dehydrated, it seems like our joints do better. The role of sugar in our diet, having all those fun comfort foods, can be very inflammatory, and the role of sugar is very important. A lot of studies are done on the role of sugar and insulin resistance in inflammation of the joints, and in general overall inflammation in the body. And that's why the less sugar in our diet, according to the World Health Organization, for women, not more than 6 teaspoons of sugar per day, and for men, not more than 9 teaspoons of sugar per day, which translates something to like 90 calories for women, like maybe 150 calories for men. But in general, less sugar, less inflammation. I have to tell you an example of one of my patients who had arthritis in her hands, and her hands were really swollen and red when she came to my office. The only thing she did for a month, and I helped her do that, was just cutting the added sugar, and basically refined carbohydrates in her diet. When she came back to my office, her hands were not red, her fingers were not red and swollen. At the same time, they were much more flexible, and she was ready to do gardening and all the hobbies that she wanted to do. I wish I could take a picture of her hands before and after cutting sugar and refined carbohydrates to show you. I wish I did that. But anyways, it is so important that we eat a high fiber, low saturated fat, and a low sugar, low salt, healthy diet to help with the inflammation and the joint pains. They can be complements also to the medications that you use, or they can help you use less medication just by following a good healthy diet. If you have any questions, please, message your questions to me, and I will answer your questions as soon as I receive them. Thank you.